Congratulations, the first part of your surgery is over. While we have some waiting time, we'll use this time to review a little bit about wound care. For most cancers, this is a very simple thing, and all you'll need is a little strip of some paper tape, which the nurses will give you, some Vaseline, and some Q-tips. So the first thing to do is wash your hands with some antibacterial soap. Then take off our bandage and gently clean over the incision with tap water and a clean washcloth, cotton ball. Then take a piece of tape and put it right on top of the stitches. If the tape doesn't stick very well, you can use some alcohol and a Q-tip to clean off the edges around the wound to remove yesterday's ointment. For wounds under significant tension, such as some on the shins, on the back, around joints, we will often use the tape in a perpendicular way to provide better support. In this case, we stick the tape tightly down on one side, stretch it across the wound, and then stick it down on the other side. So it's pulling the two edges together. You can use as many pieces of tape as you need to cover the length of the incision, and that will provide better support. And then apply some Vaseline with a Q-tip right on top of the tape. The Vaseline will soak through the tape to keep the wound moist, but doesn't prevent the tape from sticking. For wounds on the legs, sometimes we do daily bandaging, sometimes we have a waterproof bandage. But risk of infection is a little higher on the leg than the upper body from water flowing over the wound during bathing. No matter which type bandage you have, for wounds on the legs, we use an additional product called Press and Seal to protect the bandage and the wound while showering. In this case, we have you wrap the leg with a couple wraps of Press and Seal before the showers to keep the water off the wound and limit the risk for infection. If you would get concerned about infection because of redness, swelling, warmth, or pain, just give us a call. Do that each day until you come back to have the stitches out. For most wounds, we treat them with some tape support for 2 weeks after sutures are removed, and then can treat it like normal skin. Those wounds now mature under the surface for about 6 months. The goal is that by 6 months, that wound is mature and blending in nicely. If it's not, please let us know. All of this information is detailed in your post-operative instructions. If you should have any questions, feel free to review those, or you can call us at the office at 283-1033, extension 217. If it's a night or weekend, you'll have my cell number on the instruction sheet. Feel free to give me a call. Have a good week.